If you'd like to learn more about mirror therapy and what its benefits are and what evidence is there currently available that shows us that mirror therapy is definitely something that should be incorporated into your stroke survivors home rehabilitation program, then this video is definitely something that is going to be useful for you. Hi there, I'm Dr. Kenneth Monaghan. I'm a university lecturer, I'm a neuroplasticity expert, and I'm the author of Lights, Mirrors, Action, a guide for transforming the lives of caregivers and stroke survivors. I'm hugely passionate about assisting caregivers and stroke survivors to adapt their home and make it an ideal place for them to carry out their stroke rehabilitation. So it's surprised to me over the last year or two from talking to people worldwide about how many people do not know about a therapy called mirror therapy. Now, I've described mirror therapy in a previous video and I've said that it comes from the area of phantom limb pain. And there are a number of suggestions that are, of how it works. We're not 100% sure exactly how it works, but we do know that when a person, when we do functional MRI scans of our brain, we see that the same areas that work when we activate, when we use a limb, the brain areas that are activated are also activated when we cover that limb with a mirror and we look at a reflection of the other hand. So we stimulate the same areas. I mentioned before there are things called mirror neurons, a mirror neuron system that seems to be involved in this process. So when we watch an activity happening or we watch somebody else doing an activity, we activate our brains to try and carry out and replicate those activities. We know that when we watch the reflection of a mirror, of the good hand in a mirror, the electricity that goes to our brains goes to both sides, and that dormant pathways, dormant areas of our brain are activated. We know that there's a visualization benefit from looking at the reflection of the non-affected hand. What I mean by that is that normally sensory information comes from our hands and every part of our bodies every split second that goes up to our brains, and it tells our brains exactly what's happening in our bodies. But when we've had a stroke and we're not moving our limbs, or because we haven't the ability, then that information is not going in the same way up to our brains. And what seems to happen is that when we cover that limb with a mirror and we watch a reflection of the non-affected side, the visual information that we see, it travels very fast up to the brain, and it also seems to stimulate the areas that would normally be working or be stimulated from the information that should come from the limbs. So there's like a sensory substitution taking place. And another benefit that happens, which probably is not being widely heralded, is that there's when a stroke survivor cannot move their limbs, be it a leg or be it an arm, then the area that controls the movement and strength of the limb, the brain area, it starts to recede, it starts to atrophy, and there's what's called a non-use occurrence happening in the brain. So the area of the brain that controls an area, if it's not being used on a regular basis, often people have heard that term, if you don't use it, you lose it. And this is true because scans have shown that if you don't use, if you can't use a limb, as a stroke survivor can't do, then that area of their brains, it atrophies and gets a little bit smaller. So it's less likely that they're actually going to be able to control that limb because of this. And mirror therapy seems to stop this from happening because you're sending electricity up to the brain, you're activating those areas, and you're giving the person more chance of neuroplasticity. So what strong evidence is out there that mirror therapy works, that you can explain to your stroke survivor and you can educate them? Well, between 2018 and 2021, a number of very important systematic literature reviews have been published in journals worldwide. And the systematic literature review is, as I've explained in previous videos, it's the gold standard or the highest level of evidence that something works. So just a number of them. In 2018, a systematic literature review showed that when patients used mirror therapy, even after 6 months after they had their stroke, it was beneficial. It overall benefited and increased the amount of movement that they had in both their arms and in their legs. So this is a very confidence boosting piece of information to explain to your caregiver, especially for people who've had their stroke more than 6 months ago. So mirror therapy definitely has been proven to benefit after 6 months. Another systematic literature review in the same year showed that pain that often occurs in a limb after a stroke, we've mentioned this before, we've said that when you don't move your limbs, as well as the fact that they get a little bit weak and they get a little bit stiff, those limbs often exhibit painful characteristics. And this pain has been shown to be reduced by using mirror therapy in this systematic review. So again, another reason why this should be very beneficial to be used in your own home. A third review in that same year from our own Neuroplasticity Research Group showed that the lower limb, the leg, which over the first, from 1990s up until relatively recently, not a lot of evidence or not a lot of good randomized controlled trials were carried out that looked at the lower extremity or the leg. But our own research group has shown that lower extremity also benefits, or the function of the lower extremity has been shown to benefit and improve by the use of regular mirror therapy. So again, if this is the deficit that your stroke survivor has, feel confident in using mirror therapy while they're lying on a bed, to try and improve movement in the feet and the toes. And then finally, the 2021 systematic review showed that the sensation, the sensory information that goes up to the brain that often is reduced after a stroke, that information, that ability to sense things, to feel things, to decide the difference between different items, all of that information that's reduced after a stroke, it has improved by using mirror therapy as well. So mirror therapy, for the fact that it's such a cost-effective treatment, very simple to do. I demonstrate very much an initial program that can be done for the shoulder, for the arms, for the wrist and fingers in chapter 15 of Lights, Mirrors, Action, and it'll get you started. It's definitely something that should be on your list to try at home. And it definitely stimulates the brain and excites the brain and leaves neuroplasticity more likely to occur after stroke recovery. So thank you very, very much for listening. And if you would like any more resources that will back up this video, then go to my website, www.lightsmirrorsaction.com. And there you'll find some extra worksheets, you'll find some extra videos that will give you more confidence and give you more guidance about how to run a program in your own home. Thank you very, very much for listening.